The human foot is one of the best engineered parts of the body. 26 bones, 33 joints, over 100 tendons. And guess what? It's also one of the most used and abused parts of the body. So here was some advice on how to maintain happy feet is Dr. Krista Archer. Dr. Archer, thanks for joining us.
Good morning.
Okay, so 75% of us will have some kind of a foot problem in our lifetime. Does that surprise? That's a high number.
No, it doesn't surprise me because, we're walking and all that load from our body's gravity going down through our feet causes problems. Yeah. So people come to me with problems, and we could talk about the most common ones.
So what are the most common problems that you see?
So the number one problem is absolutely plantar fasciitis, which is heel pain.
Okay.
And patients are more educated now, and they come to me knowing plantar fasciitis, the word, the medical term,
right,
which is heel at the bottom of, pain at the bottom of the heel. So there's a thick, wide ligament called the plantar fascia. It's really it's fascia, but for general purposes, we'll call it a ligament. And it inserts into the bottom of the heel, and it pulls excessively. So the heel bone is covered with nerves, and it becomes very painful. So that's why it happens. And on X-ray, you can see an actual spur on the bottom of the
What is a spur?
A spur is part of the bone that comes out. It grows in direction of the pull. Okay.
And so it starts to rub into the tendon? Or?
No, it actually grows parallel to the fascia. That's the misperception, is that the spur is actually poking the foot and causing pain. That's not true. It's just evidence on X-ray to the doctor that you've had this for a while.
And what is the treatment?
Okay, the treatment, in the right hands, you can get this fixed.
Okay.
It's very, very treatable. So you want to support the fascia. Okay, so you support the fascia with, ideally, a custom orthotic.
Okay.
Okay.
An insert.
An insert.
Okay.
That a doctor molds for you.
Okay.
And is supporting that
Not
arch.
something that you're going to necessarily go down and get at the drugstore.
Well, you could try that.
Okay.
But ideally you want it to be custom. While you're waiting for your orthotics, you could get the over-the-counter, and I could do a strapping. Now I'm also using laser in my office. And laser treats that injured tissue with light therapy, infrared deep heating, to stimulate healing.
Will it ever go away completely, or are you always going to have to deal with it? It will.
It will, but if you have it, it could come back.
Okay.
So you want to do stretching, which is the cornerstone.
Right.
After you've got it resolved, to prevent it from coming back, and wear the right shoes.
Okay.
With your orthotics.
All right. Okay. Another issue, fungus.
Yeah.
Which no one likes to talk about. And I imagine even you as a doctor, you don't necessarily.
People don't like seeing their nails turn yellow and thick.
Right.
Okay. So they come to me and, they have these yellow thick nails, and they
want
to get rid of it fast.
Right.
Unfortunately, can't get rid of it super quick because the nail grows very slowly. Okay. But traditional treatment was Lamisil, which is bi-mouth oral pill, which you've probably heard about. You need blood work during therapy because it can have liver side effects. So, and
so this is not a topical treatment?
No, it's 90 days, one pill a day for 90 days. You can't drink, you can't take high cholesterol medication.
Wow, that's an intense treatment.
Yeah, intense treatment.
Okay.
So now I'm using laser for that as well. And laser with the deep heat penetrates the nail plate and the nail bed to kill the fungus.
Okay. But if you want to get rid of it, that's what you have to do.
That's what you have to do. You have to seek treatment and just deal with it, because it can get worse. Fungus loves dark, moist environments like your shoe. It's going to get worse.
All right. You can't spread this to someone else, can you?
You can.
Ugh.
Contagious.
Okay, great. Good information to know on
contagious.
this. What's another one? What's your third
My
issue
third is neuroma.
Okay.
Neuroma is when the nerve gets inflamed in between the bones of the foot. Okay. So pointy shoes with a thin leather sole, not good.
So you imagine you see a lot of ladies that are coming in with those 5-inch stilettos.
Patients come to me and they say, my foot is burning and I feel like I have a stone in the bottom of my shoe.
Okay.
So treatment, again, here we want to talk about treatment. Injections, we could do steroid or something called sclerosing, which thins the nerve. And a doctor can talk to the risk and benefits of both of those treatments. Sclerosing is usually the preferred, and that's 5 injections over a course of, a month or 2. You want to, again, orthotics to stabilize the imbalance. And it's just time to heal.
No, and you're talking about orthotics, and I've got a pair that I've used for running before. It obviously can go in all of your shoes. This is not like you have to get some kind of huge contraption that is not going to fit
Right.
into
Well,
your everyday
the thing
footwear.
is with the orthotics, we want to treat the problem fast. Okay, so we want it in a running shoe to support it. We can also make orthotics for a dress shoe.
Okay.
So you need kind of two pairs, one for the bigger shoe, one for like a dress shoe.
Okay. And your last.
My
Most
last
common problem.
bursitis.
Okay.
So ball of foot pain, right where the bones are very prominent, okay? You can get a bursa forming, which is a fluid-filled sac, and the tissue around that joint can get inflamed and painful. When a hammer toe pops up, and I don't know if you know what a hammer toe is.
Tragically, I have two of them.
Okay. So the toe pops up, and then this becomes very painful.
Yes.
Okay, underneath.
Yes.
So you want to fix the problem. You have to balance out the hammer toe.
Okay.
Surgery, usually, okay?
Okay, all right.
Or if you have an imbalance in your foot and you're getting calluses other places and you have pain under here, orthotic again to balance out that
All right.
imbalance.
I'm going to try to go with the orthotic route just for a
Versus
bit
surgery.
before I have to do the surgery, because I mean that is something a lot of people do have.
Yes.
You know.
The good thing is hammer toe surgery isn't a huge deal, but it is surgery, it is intervention, and you want to talk to your doctor about the risks and benefits of doing that.
Okay. All right. Well, good. Well, it's great information because a lot of times people look at their feet and they would really rather not. And
Yeah,
you know,
but you don't want to ignore them.
No.
Prevention is the best medicine.
Exactly. So, I
Yeah.
mean, as much as we would like to see you, we don't want to have to see you on a regular basis.
Yeah.
All right, Dr. Archer, great information. Thank
you.
For more information on this topic and others, you want to go on to the health page at abcnews.com/health.